I am Dr. Vikas Mittal, your lungs and sleep doctor. Let me ask you something. Have you ever felt that you feel tired even after you have slept at least 7 to 8 hours? And do you snore loudly, or do you wake up feeling choked, or have you ever felt groggy and excessively sleepy during the day? Well, then these could all be signs of a serious sleep disorder. And sleep test is a test which is done to diagnose these sleep disorders. There are different levels of sleep test, sleep studies which are done based on the type of sleep problem you have. So in this video, I'm going to break down the types and levels of sleep studies which we do to diagnose sleep disorders. Sleep study is also called polysomnography. It's a test in which lot of parameters are recorded during your sleep, which includes electrical activity of your brain, electrical activity of your eyes, and the muscle tone, which helps us stage your sleep, as well as it monitors your respiratory breathing by the way of nasal sensors, mouth sensors. It measures snore and then the chest and abdomen movements, leg movements, oxygen capacity. So these are all the parameters which are recorded during the sleep study. So what are the different levels of sleep study? There are 4 different levels of sleep study. The level 1 is the gold standard and the most comprehensive sleep study. Level 1 sleep study is done for all those who have complex sleep apnea, in which sleep apnea is associated with either low oxygen because of heart failure or coexisting lung problem, or some diseases like narcolepsy, parasomnia, obstructive sleep apnea associated with insomnia, or it is also used to do a CPAP and BiPAP titration studies. None of the CPAP and BiPAP titration studies can or they should never be done in a home setup. Level 1 sleep study is done at hospital or a sleep lab, and pro of this is that it is the gold standard to diagnose these sleep problems. But the con is, the disadvantage is, it is costly and labor intensive, and it requires special expertise. So level 2 study is the study which is having many parameters as in level 1 study, but it is done at the comfort of your home. Disadvantage of level 2 study is that in this there may be loss of signals because the technician is not present. Level 3 study is also done at home. This is cost effective, but the disadvantage is this contains lesser recorded parameters and just includes the parameters like the breathing parameters, the nose flow and the chest flow, and pulse rate and body position. So only 4 parameters are recorded. Also, since it doesn't monitor the brain activity and the sleep, so you may have a false negative data because you are not recording the sleep. And this is done only for those who are having a very high pre-test or a high test probability that they may have moderate to severe sleep apnea. They are apprehensive of sleeping in a controlled environment of a sleep lab, and those who have a financial constraint of getting a gold standard level 1 sleep study. Level 4 is just a screening sleep study in which we just monitor the oxygen levels and the pulse rate. This is just a screening study. So when do you do a home sleep test and when do you do a level 1 in hospital or sleep lab test? If you have a snoring problem and excessive daytime sleepiness, and as per the doctor your possibility of having obstructive sleep apnea is very high, then getting a home sleep test, a level 3 sleep test study is adequate. But in case you have suspected sleep apnea along with insomnia, or have comorbidities which causes low oxygen like heart failure or COPD, or you have any parasomnia, or you require a titration, then you need to get a in-hospital or a sleep lab based level 1 sleep study. So what are the USPs of getting a sleep study done from our wellness home clinic and sleep center? Our setup is a very comfortable setup located in a homely environment with a proper wooden bed which actually gives you a comfort of home. Our sleep lab is from Somna Medics, which is a German-based sleep lab, and it's one of the best in the market which is available as of now. It's a telemetric small, around 200 gram small device which provides freedom of movement, and the patient while sleeping can go to the washroom also. It helps in improving the quality of sleep as well as it improves the privacy. All sleep studies are done by a certified sleep technologist, and all the studies are scored by a sleep specialist, and a proper interpretation of the sleep data is given. But apart from that, the evaluation and the diagnosis is accurate because our sleep experts are well trained and are board certified sleep specialists. As a sleep specialist, I see a lot of patients moving around with a very poor quality sleep study which actually doesn't give any information, and this requires sometimes repetition of the sleep study which increases the cost. So I highly recommend to get yourself first evaluated and then get the right sleep test done before you just jump over and get the sleep study done on your own. So this was all about different levels of sleep test and which one to get for which patients, and when to get a home study as well as when to get a in labs in hospital or a sleep lab test done. I am Dr. Vikas Mittal, concluding another episode of Health Talks with Truth and Science. Learn more, live better. In case you are interested to learn more about sleep and sleep studies, and if you like this video, share this video with others, like it, and please subscribe to our YouTube channel. Thank you.